Welcome, everybody. It's the Monday edition of Health Talk, and let's jump right in here and to talk with our guest, Cheryl Alexander. She's with us from a community medical center. How are you, Cheryl?
Great. Thanks for having me, Peter.
It's good to see you again. Now, this is not your first rodeo.
No, I did this about a year ago or so on atrial fibrillation.
Okay.
They were like, she survived.
Yeah. And she's back. So I don't know why in the world that happened. But anyway, so Cheryl, now tell us the reason why you're here today.
I wanted to talk about peripheral arterial disease, and that's when people you see are walking and are having trouble and they're getting aching into their legs because they're not getting an adequate blood flow into their legs. And they're the people you see walk maybe in a mall and then have to sit down for a few minutes.
Sure.
And then walk again. So that's what we're going to talk about today.
So how would someone know that they have this? Is it visible from the outside, or is it just I get tired when I walk? Because I fit into that category.
No, it's more, you know how people know if you have plaque buildup in the arteries of your heart, it can cause a heart attack? Well, that same plaque can build up in your legs. And most people aren't really aware it's much of the same process. And so think of it like cholesterol and stuff like that building up. So it narrows the blood supply and blood flow to the leg.
Okay, now let's do a little basic anatomy for folks who are like me, who are kind of basic. I'm an ignorant guy. I ask all the dumb questions. Okay. So there are veins and there are arteries.
Right.
Okay, so tell me the difference between the two and where the plaque builds up. Does it build up in both or just the arteries?
So we're talking about the arteries.
Okay.
Arteries have kind of a muscular wall, and veins are more like bendy.
I wish I could show you her hand.
Sorry about that.
Just imagine the little balloon men that hang outside of the automobile stores.
That is actually a word, bendy.
Yeah, yes. But no, arteries take blood away from the heart, so they flow down the leg. So we're talking about the arteries of the legs.
All right.
Blood, when you go to walk, your muscles require blood and oxygen. And so when you walk, if there wasn't an adequate blood flow down there, it would start to ache. The muscles wouldn't be getting the blood that it needs to work. So that's what we're talking about. And when it gets severe, about 8 million people in America have this. So it's not tiny. And so when they walk, their muscles aren't getting enough blood flow, and it starts to ache and hurt, and they feel very heavy.
How much of this has to do with varicose veins? Is that
Nothing.
So this is a totally different
That's
thing.
the vein side. Vein side returns blood from
Gotcha.
the heart.
Okay.
We just went over this. Sorry. Floppy hands.
I forgot that there was a vein at the end of varicose. See, I thought I was going to ask this brilliant question and then slap me upside the head. Wow. Okay. So is there such a thing? Okay, I'll try to redeem myself.
Yeah.
Is there such a thing as varicose artery disease?
Well, no.
No.
Actually,
See, I'm going home now.
No, it's okay. It's kind of like there's tortuous arteries that because of the plaque. But really, the varicose veins is another topic entirely.
Sure,
and that's
Okay.
A superficial.
Right.
This is what your legs need in order to work. So many years ago, before we could do anything about it, people would amputate their feet or their legs because they weren't getting enough blood flow, and eventually the muscle dies.
So what do we do now? Give people RoboCop legs or what?
No, we roto-rooter. So kind of like that.
Like,
all right.
Really? Like,
It's called an atherectomy, and they actually go in and roto-rooter through the blockages. And then on the end of the little nose cone, it collects, obviously, all the gunk.
so it's like a vacuum?
Sort of.
What does it sound like? Perfect. You're hired. So it goes through.
So it goes in, it collects all the gunk, and we pull it out. And another treatment involves going in with a little balloon. And they go down into the area with the balloon, down into the artery, very small arteries at times, and they expand the balloon, and it just pushes the plaque against the walls. But the interesting thing now about the balloon is it's drug-coated. So when it pushes out against the walls, and then we collapse it and take it away, that drug that we've put in there will stay against the walls, and that helps keep the arteries open.
So what causes the plaque to build up in the arteries in the first place?
Number one is
not brushing, right?
cholesterol.
No?
Lord.
Think of cholesterol. Think of plaque lining those arteries. Smoking is probably the worst thing of all for this. Okay. Yeah, it really is. It prevents kind of that natural opening and closing of the arteries naturally. Diabetes, a lot of people with diabetes have this, and then high blood pressure.
Yeah, I remember when I was a lot younger than I am now, I had to have what is called an arterial stick, where they had to actually get the blood from the artery. They usually just go through a vein. Yeah. And the technician, the phlebotomist on duty, was having a terrible time because I didn't realize, you had just said, the arterial system has its own nervous system. And it literally will jump out of the way of the needle. And the poor gal was saying, whoop, 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 whoop. And I was kind of, I was like, could my face get any more pale? And so I learned a little something about the arterial system from that, in a very mild way.
Yeah.
But we are fearfully and wonderfully made, are we not?
Yeah, it's absolutely amazing.
Yeah.
But when they go into the artery, then the Dr. Hinich, who does this, he's probably the foremost guy that does these procedures in all of western Montana. And he has two large screens in front of him, and then he shoots dye down the legs. And based on that, we can see if there's narrowings and then go in and balloon them.
So when you balloon the artery, and it pushes all the plaque to the wall and drug coats it, which I still don't know what that actually means. when it's in there, I mean, isn't that just like waiting for another bad day? I mean, you've still got all the plaque in there. It's eventually going to collect again, right?
Yes, but it usually collects in another area. So usually the area that we've opened up doesn't tend to collapse again, but other areas develop.
Is there any way, again, asking the silly question, is there any way surgically to remove and replace an artery, or are you pretty much stuck with what you got?
Well, if this doesn't work, what we do, going in either the roto-rooter or the ballooning, then what's left is a bypass. Then they take an artery from somewhere else or even a vein and sew it in place of it to totally bypass.
But that's a much more serious solution, right? That's a big surgery compared to these other...
Right. Endovascular, meaning we just go in through the arteries and we don't have to open you up. The other procedure I'm talking about that's open surgery.
Right. So. We're up against a break. Cheryl Alexander is joining us. She's a physician's assistant in cardiology, working with Dr. Yinich. And give us a call if you have questions about this. Maybe you've been walking around the mall and really realizing, oh my gosh, I got to just sit down. We could be describing what's going on with you. So if you have a question or a comment, she's here to chat. We actually have real radio headphones for her. And so we don't want to give her headphone hair, though. 721-1290 is our number. We're going to come right back with more of Health Talk in a moment. We're back on Health Talk, and joining us from Community Medical Center, Cheryl Alexander. She's a physician's assistant, a PA, if you will. Is that the proper term?
Yes, it is.
The PA. We call it a public address announcement. It's a totally different thing. Anyway, you have a lot more study than I do, being a PA guy at the football game. So anyway, go ahead, John.
Although apparently balloons are involved in both fields. So that's good. I am curious, what is your balloon? I mean, do you have a medical balloon, or do you just go down to the party store and people can pick their color? Or?
It's a really, really small party balloon. No, it's obviously a medical balloon that goes in. Think about how small it needs to be in order to go all the way into an artery.
So it's a teeny, tiny balloon.
It's teeny, tiny, skinny. I would have brought one to show you guys, but it wouldn't have helped the listeners.
Well, but you would have to charge us. You'd have to charge us $1,000.
If I pop that on air, that could be show of the year.
There you go.
So we talked a lot about the two procedures, and then the third kind of backup if those don't work.
Right.
But tell us some of the ways that we can identify it in our friends and family.
So one thing that people don't really see is erectile dysfunction as possibly one of the symptoms. It's wherever there's decreased blood flow, and the blood flow for erectile dysfunction does come from the lower abdomen, and that's where this plaque begins. So most people don't realize that can be one. Another one is if you have ulcers or sores on your feet that don't heal. I mean, they don't heal for months, 4 months, 6 months. Those people should absolutely go to their primary care physician and say, something's wrong. This is not healing. And often it can be the blood supply.
Now, when we talk about ordinarily, under ordinary circumstances, let's say you get a cut on your foot or you bash it against you stub your toe or whatever, and what's the usual amount of time that you can expect for that to just naturally heal?
Oh, within a few days to maybe a week.
Okay.
So we're really talking about ulcers that don't heal. And it's not just diabetics. I mean, often people don't recognize that these symptoms, this sort of constellation of symptoms, all go together. It's like I said, walking through Costco and you have to sit down, or the sore that didn't heal. So people, or erectile dysfunction, so they really don't necessarily recognize all of those.
Or talk publicly about it, I would assume, right? It's not one of those things you bring up at the family dinner table.
Well, often it's God, I'm walking and I'm getting so tired or heavy, that sort of thing. Publicly, I guess, is okay to talk about.
Now, is obesity a part of this, or does it have to be an obese person?
No, not at all.
Okay, all right.
We have rail thin people that are this, because most people don't recognize 85% of our cholesterol is manufactured by our own liver. So that's genetics. So your body is constantly laying down cholesterol.
So cholesterol is not a bad thing, right? We need cholesterol.
No, we need cholesterol because our cells, the outside membranes of our cells, the only thing, or one of the things that holds them together is cholesterol.
Okay.
So we need it. We just don't need too much of it, and we don't need the bad cholesterol.
So why can't our body just flush out the bad cholesterol? Is there...
$1 million question.
Is there just like did we forget something? I mean...
No, but we didn't have the diet we have now.
So
we didn't have the heavy meat, potatoes, butter, whole milk diet.
Well, if that's the argument, then couldn't we just change our problem by having a different diet?
Well, in many parts of the world, they don't have these issues.
Or would changing your diet actually help what you've already got? Let's say you've already got this problem. Will changing your diet make any difference?
Well, I think it's a great place to start.
Okay.
And even more important than that is stop smoking.
Yeah.
I mean, that's that and high blood pressure. So all three of those things are modifiable risks, we call them. Things that you can change.
Okay, we have a caller. Strap those headphones on. Let's get Dennis on the line. Dennis, you're on with Cheryl Alexander. Good morning.
Good morning. I'm just curious now, would the process of EECP help work on that leg problem?
What is the process of EECP? Dennis, are you there?
Dennis,
yeah, I'm still here.
What is the process of EECP?
You're fading out, but go ahead real quickly.
Well, EECP's electronic external counterpulsation.
I don't know. I'm not familiar with that therapy, so I can't tell you that. But in addition to what we did talk about, they also can have some stenting in the leg. I mean, but it's rare that we actually have to put stents in to hold things open.
So we had to let Dennis go because we really had a problem with the line there.
Someone was electropulsing the,
I guess so.
The line, I guess.
Yeah.
So the issue with diet, you had mentioned earlier that smoking is one of the leading factors to cholesterol buildup in the legs.
No.
Okay.
Just smoking affects the arteries throughout your entire body.
Just weakens them?
Well, it actually prevents, you naturally have some what we call vasodilation, an slight opening of an artery, and vasoconstriction, kind of a closing of the artery. And smoking prevents that natural movement and also prevents sometimes healing into those arteries because things get damaged naturally and your body heals it naturally.
But how does it? I'm not a smoker, but I'm just really curious. I smoke, it goes into my lungs, it comes out my nose, and somehow it gets up in my legs.
No, yeah, that's such a great question. Yeah. So when you smoke, it goes into your lungs, and then through the lungs, it goes right into the bloodstream.
Okay.
It's amazing.
Well, smoking is an equal opportunity killer, in case you're wondering.
Not the actual smoke, it's the drugs and nicotine and all the damaging formaldehyde, all the things that are in smoke.
So it makes my arteries just relax, a little too much.
I wish
they don't work right.
I wish it more prevents that from happening. If it was open and vasodilated,
it makes them brittle.
Yeah, and it causes just the opposite, more of that vasoconstriction or narrowing of the arteries. And you have that, plus you have plaque in the arteries. When you go to walk, you're not going to get the blood flow you need. So it's really a combination of both disposable.
Let me ask is how effective is this treatment? I mean,
oh my God, it saves people's legs.
Okay,
it's amazing, and sometimes these procedures take 4, 5, and 6 hours to get through the areas that are blocked and open them up. And I have patients that can't walk a block, and I see them 2 weeks after the procedure, and they walked a mile. No, I mean, it's dramatic.
Is this the kind of surgery that is under anesthesia the whole bit, or is it in office type?
No, it's in our cath lab, but it's called conscious sedation, so you just feel good. And that's the best way to say it.
You remember the 70s, right?
Right.
It's kind of like just hook them up to talk back, and they'll be so numb they won't feel anything. They'll just be giggling all the time,
and they don't remember it.
Yeah, right, we're going to take a break. Come right back, and we'll get some contact information and some. We'll just go over the top points again of why this is important, why we need to look out for it, especially if there's someone in your family or a loved one or a friend that you notice these kind of symptoms in. Tap them on the shoulder and say, "Hey, I was listening on Health Talk yesterday, and this is what they said." We're going to come right back. Okay, we're back. This is Health Talk and Community Medical Center, the wonderful sponsor of the show, Cheryl Alexander, is physician's assistant. And we just found out something, that she also has been involved in chiropractic, chiropractic, right?
Well, chiropractic.
Okay.
You're right.
Chiropractic.
And in addition to being a PA, I have been a chiropractor for 25 years.
Okay. So when people are on the goofy juice, do you give them a little extra chiropractor treatment?
No, I keep those patients very separate. Very funny, but no.
The goofy juice. I like that.
I know. I'm sure they have better names for it.
Yeah.
Yeah.
All right. So you were just telling John, and this is just an aside here. We have a couple of minutes. He has a little nervous thing that he does. He kind of twists his neck a little bit. Right?
Yeah, he self-adjusts his neck, and I was just telling him that's not very good for your neck.
See, there you go. See how that works. Now we had another call coming in here, so hopefully we'll have time to get this call. I've got about 2.5 minutes left in the program, so let's get Mike on the line real quickly. Mike, what's your question?
Well, my question is this: you're talking about being short of breath. If you're short of breath, check your medications first, because there's several of them will make you sound like you got a worst-case emphysema, and one of them is a blood thinner, Plavix. I have another one here. I forget what it is. It's kind of supposed to replace, anyway.
Well, Mike,
check your medications first and read the read the side effects, because I can guarantee you a lot of this has with your medication.
All right.
Okay.
Thanks, Mike.
Thanks, Mike. Appreciate it.
We're really talking about shortness of breath, but it is important to read your medications. I think we could all agree with that.
Absolutely. And one thing he does bring up are the medications. So following a procedure, we talked about the drug-coated balloon, which helps keep the arteries open. And then we do other medications, like one of the ones he actually mentioned, which is called Plavix. And what that does is help prevent platelets from sticking to the surface of the artery right where you just opened it up and causing it to clog back up.
Is that the drug on the balloon? I mean, what?
No, actually, I don't know. I don't know the specific drugs they use on the balloon that keeps it open. I'm not familiar with that.
We have exactly 1 minute left in the program. Okay. So I'm sorry about that.
No more drug balloons.
We have so many questions. We just need some contact information. If folks want to get more information about this or want to make an appointment, what do they do?
Oh, please call Montana Heart Center at Community Medical Center. Okay. And Dr. David Hinich is the doctor that works on you, and I would see you before and after the procedures.
And by the way, Cheryl, she's a hoot. She is really fun, and I'm sure people love coming into your office, right?
We have a very busy practice.
There you go.
Put it that way.
There you go. All right. So give us a phone number, or is there a phone number or a website? We'll just the Montana Heart
Center.
Montana Heart Center at Community Medical Center. Well, that's 728-4100 is the main number.
Absolutely.
All right. They'll get you hooked up.